So today we're at the Buxton Osteopath Clinic and we are speaking to the principal osteopath of the clinic, which is Phil. Hi Phil. You're going to talk us through osteopathy today and explain what it all entails, are you not?
Yes indeed. Osteopathy is a form of musculoskeletal medicine, and as such, as osteopaths, we deal with major and minor soft tissue and joint injuries. Osteopathy, as an osteopath, we look at soft tissue, we look at muscles, muscle tendons, ligaments, blood, nerve supply, and we even look at the internal organs, and we relate this to how the body works as a holistic structure.
That's a lot more scientific than I realised. I had no idea that
Yeah,
it entailed that much of the human body. I thought maybe it was just bones.
Well, that's a common misconception. I mean, we deal with the body head to toe, and we deal with all joints. We deal with the feet, knees, hips, lower back, shoulders, wrists, elbows, and even fingers sometimes.
Right, and I thought it was just the spine. So I've learned something. Well, I've learned a lot in just
No, we
short
really are musculoskeletal specialists, and as such, we deal with the whole body.
I think that a lot of viewers don't actually understand that, and I think that's the big misconception that's out there. We just think maybe they're covering the spine and that's it. Phil, could you tell us about the sort of training that you go through to become an osteopath, and what sort of regulations are in place to actually protect the patients that you treat?
Yes, certainly. I think it's nice to know that people have got the confidence to know that they're in safe hands. We undertake a 4-year osteopathy degree, and thereafter we have to be registered with the General Osteopathic Council. So we have to be CLB checked each year. It's also critical for us that we undertake continuing professional development, which they check that we do and undertake each year. We also pay a registration fee, and currently the process is being reviewed, so we will have to be revalidated as well after a certain amount of time.
So there's constant checks to make sure that you're always up to date, that you know what you're doing, and that your patients are always in safe hands.
Absolutely.
Great. And can you tell me a little bit about the kind of patients that you do see and what sort of injuries they have?
Yes, absolutely. I mean, we see people of all age groups. We see older people who are perhaps growing a little bit older and wiser and have degenerative changes, a little bit of wear and tear, perhaps in neck, shoulders, upper back, lower back, hips and knees. So they might have some joint restrictions as such. We see younger people who have traumatic injuries through contact sports or accidents. We see a lot of self-employed people who are perhaps plasterers, builders or gardeners. And we also see a lot of people with repetitive strain injuries as well, which is quite common in the modern workplace environment for people working on computers, which can lead to problems with sort of neck, head, shoulders, and also with elbows as well. So there's a very wide remit.
And I believe also women who've gone through pregnancy, doesn't that affect something to do with the spine? I've heard that before, where they said, oh, I've got to go to my osteopath for pregnancy, really put my spine out. Is that true? Is that what happens?
Absolutely true. I think as the posture adapts to pregnancy, there are changes in the pelvis, changes in the spine, obviously changes in the upper back as well, because I mean the whole spine, the whole body adjusts to a different sort of centre of gravity, so there are sort of modifications and compensations that occur. So yeah, maternity clinic forms quite a reasonable proportion of our sort of patient ingress.
Wow. And what about RTA victims?
Yes, road traffic accidents, that's another common thing that we see. We do quite a little bit of work for insurance companies, and again it's just one of those incredibly traumatic injuries where people suddenly go through acceleration or deceleration injuries, depending on if they hit somebody or somebody hits them. So it does a lot of soft tissue damage and a lot of irritation to the joints, both in the neck and in the upper back. And indeed, with a seatbelt going across the body, it can also cause a lot of rotation and injury to the lower back as well.
Oh my gosh, I didn't realise. So what kind of treatments do you give your patients?
Well, basically our treatment approach varies from patient to patient. Obviously our treatment techniques that we use are tailor-made for that particular patient and for that particular trauma. So obviously for very painful issues such as road traffic accidents, obviously the approach is very gentle. And as things improve, we can be a little bit more gradually interventional. But the main thing is it's done within the comfort levels of the patient. So
What techniques do you usually employ when you're treating a patient, depending on injury and so forth?
Well, we use gentle repetitive movements, and we use soft tissue stretching techniques and gentle massage. So what we're looking to do is gently mobilising a joint if it's a joint problem, and encourage the body to heal and put it in the best position where it can heal and remedy the problem.
And is it different between if you're working more on the skeletal system to the muscle?
Well, the musculoskeletal system probably includes all structures, including muscle. So we do use a range of different modalities. We do use electrotherapy, for instance. So if we have a structure that contains a lot of collagen, and collagen's the major component in tendons and ligaments, we can use ultrasound specifically for problems like that. If it's more of a joint issue, what we do, for instance, is we'd work around the muscles, muscle tendons and ligaments around the joint to help release the pressure on the joint. And we can do gentle manipulations on the joint itself as well. And again, this is done within the comfort levels of the patient.
When a patient comes to you, what do you first do before you start any treatments? You have to ask about what's going on with them, and
Absolutely.
Consultation, I suppose. There must be some form that you can sort of explain.
Absolutely. When people first come and see us, it's probably important to recognise that we do consultation and treatment, but the consultation does form a big part of the information that we need and we have to gather. So we do a comprehensive case history that involve all their past medical history. It'll involve their occupation, what they do currently, and that'll be interwoven into our summary in terms of understanding how the problem came about. And patients will also be given a complete prognosis in terms of how long it'll take for them to heal. But ultimately the consultation involves administrative detail, basic administrative detail. Then it involves, we need to know whether they're on any medication, because sometimes we have to work around that. And as we've already mentioned, we need to know if the problem's happened before. So, and if it has happened before, we need to know how long it took time to resolve previously, put it into context of the current situation. And obviously consultation will involve examination as well. So we will ask the patient to undress, so we need to see the area where we have the problem. And we'll look at somebody's posture and very gently put them through a range of passive movements and active movements as well. So we look at the whole body as a whole. So if somebody comes in with a knee problem, we'll want to look at the hips, see how the hips functioning, we want to see how the spine's functioning, and we want to see how the ankle's functioning below to put the body into best possible position to heal.
Is it possible if a person has in general bad posture that they're causing problems in the future with their muscles or their skeletal system?
Yes, well, I don't think I've yet met anyone who's got the perfect posture, I don't think, at this point. I mean, obviously, we do work towards an ideal. However, if you examine everyone's spine, we all have our own little idiosyncrasies, so no one's perfect.
Phil, I'm dying to ask the question about whiplash. Is it actually real? Because people think it's just a made-up injury that people claim insurance on.
Yeah.
Is it true? Does it happen? And what's the cause of it if it is real?
Well, it is a very real symptom set. They come in two forms. You get an acceleration injury and a deceleration injury. And if you think about it, if somebody hits you from behind, the body's pushed forward, the neck goes into hyperflexion, and a lot of the soft tissue structures here get damaged through that severe movement. And then combined to which is usually the recoil, so you go into hyperextension as well. And that causes sudden dramatic compression on the joints in the neck, which are called facet joints. So it really does manifest in quite a painful condition, really, and the symptoms can perpetuate up to 12 to 18 months sometimes, and take a long time to resolve. So it is a very genuine set of conditions. The other injury is what we call deceleration injury, when you run into the back of somebody else, and basically the head is forced into hyperextension initially and then hyperflexion. So it's more or less the reverse of what I've just explained. But both of those set of conditions do result in a genuinely very painful symptoms.
And that's called whiplash.
It is
so it's
indeed.
real.
It is indeed.
Oh my gosh, that's something else I've learned today, because we always thought that wasn't a real injury. Now, with your patients, do they have to come through a GP or can they just book you directly? How does it work?
Well, that's a very good question. It isn't necessary to consult your GP before you come and see us. I mean, a lot of people do get frustrated these days because it takes a long time to make a booking with your GP, and often it's not done at your convenience. So I suppose the advantage in private healthcare is you can ring us up and come and see us the very next day.
So if you got up out of bed one day and for some reason you just did your back in, you took the wrong step or something in the shower, anything like that, and you feel like you're absolutely crippled and you can't wait to go and see a GP to then wait weeks to see an osteo, I can just call you up.
Yes, that's right. I mean, the traditional process is going to see your GP and then probably waiting for a referral to see an NHS physiotherapist. However, I mean, you know, you can come and see us in early morning before you go to work, or late evening if that's what you want to do, or even at the weekends.
Because I know when people do their backs, and to them it's their lives, and they feel like they're in an emergency situation. They can't go on a moment longer without help. So waiting for the NHS to kick in sometimes doesn't work, or the process doesn't work. So emergency appointments are quite valuable to people at times.
Well, absolutely. I mean, we've all got busy lives. You know, we can't put our lives on hold. You know, whether it's for work or whether it's busy family life. Okay, this gentleman's presented to us with lower back pain, which does make a high proportion of the symptoms that we see, and in particular he's come with left lower back pain. So this is sort of consistent with an over-rotation injury or a lifting injury, and basically there's joint irritation. So generally what we do initially is we do a little bit of soft tissue work just to help reduce the soft tissue tension in the area, and we'd also later on in the treatment aim to sort of mobilise this joint and perhaps release the joint as well. So this gentleman's had a couple of treatments with us, and he seems to be progressing quite well. Okay, here we're just doing a gentle technique to help mobilise the area that's been affected. Osteopathy, as we said earlier on, does rely on movement, so we're just gently bringing the patient's knees up to his chest and putting what we call flexion through. Again, just to help remove any restrictions from the area that's been affected. This is done obviously within the comfort levels of the patient, and he's been to see us 2 times now, so his comfort has increased and he's in less pain. Again, the technique we're doing, we've done a little bit of soft tissue stretching and soft tissue mobilisation, and we've gently put different vectors of movement through the joint, but what we're doing now is we're being much more specific to the area, and we're currently very specific to the facet joint where his problem is, and this technique sort of demonstrates a simple basic joint manipulation where we just mobilise the joint like that and just release the joint, and that helps remove any inflammation or any irritation from the area.
Phil, when a patient comes to you with a lower back injury and really quite low, and they can't bend and they can't move, what is actually happening to this area? If you can explain what it is that's really happened to them.
Well, generally speaking, a lot of it's to do with physics, because our upper body weight is essentially 2/3 of our body weight, and if we bend forward, the only 2 joints joining the upper body to the lower body are these 2 joints here. Now, the lower back is correctly termed as the lumbar spine, and it has 5 vertebrae. It has lumbar 1, lumbar 2, lumbar 3, lumbar 4, lumbar 5. So it's really these 2 joints on the L5 which are joined to the pelvis, which are often involved in presentations which involve leaning forward or twisting. So most commonly that's also joined with rotation as well, so people often lean forward and rotate to pick something up on the left or the right, or perhaps they might do it as a repetitive movement through simple domestic things at home like hoovering.
So Do they get swelling in these areas? What happens? Is it fluid that builds up?
Well, these two little joints gradually get irritated, particularly with repetitive type movements like hoovering, for instance, over a period of 20-25
It's all
minutes.
that, isn't it?
Exactly.
Right.
The muscles get fatigued. The idea is the muscles help to protect the joints. And the muscles gradually get weaker and weaker as they get more fatigued, and eventually the joint will become irritated. And it's quite common for us to see someone with either joint irritation on the right side or specifically the left side, or even both. If that's the case, it is pretty painful.
And that's when they're like really crying in pain and they say they can't stand upright or they can't
Indeed,
put their shoes on. And
Indeed, yeah.
like
The most common thing that people will complain of is putting their socks on in the morning, getting out of a car, from sitting to standing. So, and indeed, any twisting or rotation of the pelvis as well will be quite painful. And often these injuries can also involve soft tissue structures as well, be it muscles or ligaments.
Been looking at this area, Phil. What is this particularly? And what does it do? What is it called?
Very good question. Well, this nerve is the sciatic nerve, and if you turn the spine round just to face towards the camera, you can see that these three nerves in the lower back coalesce to help form the sciatic nerve. Now, one of the problems is that quite a frequent presentation is if the joints are badly affected, there's a lot of inflammation around the area, and the inflammation is essentially fluid build-up inside the tissue. And this fluid build-up compresses on the nerve, basically. That being the case, you then get referred pain through the sciatic nerve. And the sciatic nerve in particular, it's just like a big electricity cable that supplies electricity to the muscles in the gluteal or the buttock area, the hamstring and the calf, and it goes as far as the foot as well. So if there is a lot of inflammation, you can get a sciatic referral, and again that makes up a big proportion of our lower back pain presentations.
And is that what people call, I have sciatica, when they say, oh, I've got a bit of sciatica? Is it that what's going on?
There sometimes is a difference between what people perceive to be sciatica and what actually is sciatica, but as I've explained it, strictly speaking, that's sciatica. There's also another term called lumbago as well, which is quite often used as a general lower back pain. But sciatica specifically refers to more or less a trapped nerve, if you like, or impingement on the sciatic nerve.
And what is the lumbago?
Lumbago is sort of a term for chronic lower back pain, so it's more of a generalised term, it's not very specific.
Oh, I see. When a patient comes to you and they're complaining about the problem with the back and awful pain, when you have a feel, do you actually feel the swelling, or how do you know that there is swelling and damage done?
Obviously, depending on, as we explained about consultation earlier on, if people are able to undertake active movements, that will give us a very clear indication. But when we look at passive movement, we will also palpate on the spine, and often if there is a lot of inflammation and irritation, it will be palpable.
So their pain will let you know what's happening?
Yeah, absolutely, absolutely.
How do you understand what trauma or injury is going on in this area of your patient?
Well, when they initially come in, we will ask them to undertake some active movements depending on their level of comfort. And then we will examine them passively, and we will examine each of the vertebrae, we'll palpate in these areas, and often if there is extensive inflammation there will be pain over these joints as well. But the muscles of course will be very tight as well, and to a certain extent obviously the patient's reaction as you gently palpate will sort of give an indication exactly where the area of concern is.
So any signs of discomfort or cries of pain is letting you know what's going on in what area?
Well, obviously our main aim is to cause people minimum discomfort, but it will be obvious, but you go in very gently and gradually as you examine the area, so it will become evident.
Thank you, Phil. This has been so educational and I've really enjoyed it.
It's my pleasure.